CBS News medical contributor Dr. David Agus has been in contact with the White House about the coronavirus, and he joins us from Los Angeles to discuss the federal government's response and also getting enough medical supplies to tackle the virus. Doctor, good morning. I'd like to begin with something people have not heard a lot about, and that is the possibility of an antibody test to tell if the virus has been in somebody's system. How would that work, and why might it be helpful?
Well, across the country now, many people are having mild symptoms and are told to stay home because of the shortage of tests, and they're not being tested. And so at some point, you have to know whether you're exposed to the virus or not. And in the next several weeks, this test will be launched. Hopefully, it's even sooner. And the power is, if you've been exposed, what we know is for several months at least, we don't know long term, but several months, you are immune to the virus if you've already been exposed and recovered. So in a sense, we could create a cohort of workers across the country to be the ambulance drivers, to check out at the grocery stores, working in the emergency rooms, who won't get sick if they're exposed again to the virus. So this test is critical to round 2 of fighting the virus.
We're hearing more and more stories, David, about healthy people who have it, who are passing it on. Idris Elba just did a big interview with Oprah where he said he had no idea that he had it. He's passed it on. We've heard about basketball players that have tested positive, feeling very healthy. There are reports that they've passed it on. How do you deal with something like that?
Well, I mean, that's difficult because when you don't know you have it, you mean to do well, but you go out and you actually take liberties that you probably shouldn't, and you can spread the virus. And so that's what we're concerned about. But those people also can be our front line because they're not going to get the virus again, at least in the short term. They're, as volunteers, helping all of us to protect the elderly and the people with medical conditions who can't get the virus because of what could happen to them.
Why is 15 days the magic number? We keep hearing 15 days, 15 days. Why is that the magic number, and how realistic is that really?
That's a great question. The answer is we just don't know. So when we make interventions like we all have done this last week, the whole country has come through in such an amazing and positive way, is classically it takes 7 to 10 to 12 days to see the impact of those changes on the virus because of the incubation period of the virus. So the assumption is that 15 days we'll know where we are, and the hope is we've dramatically decreased spread of the virus. If we decrease spread of the virus, we're not going to overwhelm our medical infrastructure. We've been given time to develop drugs that will work in terms of treating the drug and preventing it from being spread, so we need that time.
David, from where you are and what you know, how dire is the medical supply shortage?
Well, the medical supply storage is in kind of 2 buckets, if you will. It's supplies like the masks and the gowns, and then it's the drugs to treat it. The masks and the gowns, we're starting to see a little bit of easing of supply. It's certainly not where it needs to be, but companies are stepping up. People are making them. People are making hand sanitizers, alcohol-based companies and all. That part is exciting, and I think offers some hope there. In terms of drugs or therapeutics, we're seeing bigger supplies come in this week. And so obviously when the president announced that hydroxychloroquine may be effective against the virus, nationwide doctors started to prescribe it for patients, and we're now low on the drug. Much more of a supply is coming in toward the end of this week. And so we're starting to get a little bit encouraged that we're going to hit some of these supply issues. I think we're all stepping up, whether they be the government or doctors or the whole of America, to really make an impact on this disease and certainly play offense instead of defense.
Hey, you just gave me a new phrase, stepping up. Stay home, stay safe, step up. All right. Thank you, David Agus. Always good to have you with us. Always good to have you with us.